All right, ladies. Now, there may be subjects that you aren't comfortable maybe talking about, but if we don't talk about them, we will never know there is possibly a life-changing solution out there for your health. That is why Dr. Susan Collada is here to talk about how the Mona Lisa touch could be that for many women. Doctor, thank you so much for coming in.
Oh, definitely my pleasure.
So we're talking about the Mona Lisa touch today. Let's actually start with who is the right person that this would be for.
Any woman who started to have age-related changes in the vagina, and that can be someone who is truly age-related or someone who has had breast cancer and had treatment for that. And one of the treatments is removing the estrogen from the body, and that will make the vaginal area a little bit drier and more uncomfortable.
And like I was saying, this may not be a subject that we're all jumping to talk about,
Right.
but if we talk about it, especially in this kind of a platform, somebody out there is going to have a life-changing light bulb moment that
And
this
it
is
really
meant.
can be life-changing.
So tell me about the treatment, about the Mona Lisa touch.
The Mona Lisa touch is a laser for the vagina, so it's similar to what people are getting on their faces, only in a much more private area. And what's special about the Mona Lisa touch, it's 3 different treatments.
Okay.
The first one goes pretty much superficial, but a little bit deeper. But each time you get another treatment, it goes deeper, so the treatment will last longer. And it's really fascinating to see the changes in the skin from a very thin, dry tissue to a thicker. I think we have a picture on there now, and that's after 1 treatment. And
wow.
each time it will get a little bit deeper. So after the 3rd treatment, it will last up to a year.
Wow.
And women can notice a difference pretty much right away. And not only it can help discomfort with intercourse, but some women also notice that their orgasms are a little bit better.
Oh, there's an added bonus in there.
And it also can help with incontinence, so urinary leakage.
So there's many reasons, benefits to this.
Right.
So, and I'm sure some of the questions that come along with this is the treatment painful?
No, and I can say that not just as a physician saying, honey, it's not going to hurt. But I had it done to myself.
Okay.
And the first time it's a little puff of air feeling, a little twinge. We also do the outside labia. And that can be a little bit prickly, but I can't say it was painful at all.
That's always good to hear.
Yes. Yeah.
What about the recovery from it?
We give out an ice pack and say use it for a while. I did my treatment right before I did a whole bunch of ladies, so I would sit on the ice pack and move around and come back, and after 20 minutes didn't feel it was necessary. Maybe burning the first time you urinate occasionally, then a couple days later you don't even notice that it's there. So recovery is very fast. The downside I found most bothersome to me is that you can't sit in a bathtub for 2 days.
Okay.
And I love spending hours in the bathtub. And then no intercourse for a week.
Okay.
So that because the tissue has to heal.
Right.
Yeah.
So, and that kind of comes, how far apart are these treatments then?
6 weeks for the first 3, and then yearly.
Okay, and then yearly after
for
that.
Kind of a tune-up.
A tune-up. That's a good way to put it. And so I know we were kind of talking about which women this might be best for. Is the best thing to come in and to actually see if this is right for me?
Yes, and also we give seminars and we'll go over it as well. The only people it's really not appropriate for is anyone who's had vaginal mesh or significant prolapse, and prolapse is the vagina falling. So if things are falling down too much, then it's probably not a good option, and if there's a lot of mesh in there, we shouldn't do it.
Well, and we were just looking at that statistic on the screen right now. Millions of women have benefited from this. Millions. And
but
so
millions have problems.
Yes.
Yes.
And so we are going to know that this is something that's needed out there. This is exactly why we're talking about it, because we know there's the people that may not know that this is available to them. And we did mention about seminars. I know you have one coming up, and this is kind of a very relaxed setting to talk about maybe an uncomfortable subject.
Right. We go over the overall indications and reasons not to do it. And same thing we're talking about right now. And then afterwards, there's an opportunity to ask individual questions. But of course, we don't examine the ladies at that event.
Yeah, but I can ask, I'm trying to ask as many questions as I possibly can, but I always know there's going to be more, and that's the perfect setting to do it.
Right, exactly.
So I'm going to remind everyone one more time when that seminar is. They can come in, get all their questions answered in a very relaxed, easy setting. But Doctor, thank you so much for not only telling us about this, but telling us about your own personal experience as well.
My pleasure.
Oh, this has been wonderful. Now, you at home, you are invited to attend a patient education seminar this Thursday at 5:30 p.m. at 2260 West Orange Grove Road. For more details, call 351-5595 or visit MonaLisaTucson.com.